This video is going to cover the 6 key levels in the thorax on axial planes. So the 5 vessel levels, the first one, which you can see on the right hand side of your screen, this is at the vertebral level T3, which is highlighted here for you, so you can see the rib obviously coming off of the T3 vertebra, so that's going to be the third rib, of course. And so some of the key structures that you can appreciate on this view, which again, remember, this is going to be the patient's right, this is the patient's left. So in this view, you can see the right brachiocephalic vein, the left brachiocephalic vein, which tends to look a little bit longer and more kind of an oblique plane based on its diagonal course as it's descending across the superior mediastinum to join with, or anastomose with, the right brachiocephalic vein to ultimately form the superior vena cava. Which you'll note that this structure right here, of course, the sternum, so the structure closest, or the vessel closest to the sternum, is going to be the left brachiocephalic vein. You can also see the innominate artery, also known as the brachiocephalic artery, which I'm highlighting right here. And then finally, we have the left common carotid and the left subclavian arteries there as well. In the midline, you'll notice, of course, the dark black structure right here is the trachea, and just posterior to that, we have the esophagus. So here's a diagrammatic view of what we were just looking at. So again, you can appreciate the location of the right brachiocephalic vein at this T3 level, so the 5 vessel view that we just talked about, the kind of long and most anterior, the longish appearance and the most anteriorly positioned vessel being the left brachiocephalic vein. You can see the innominate artery or the brachiocephalic artery, and then the left common carotid and the left subclavian artery located right here. And then again in the midline, we had the trachea with the esophagus located just posterior to that. And then usually surrounding the trachea, we have paratracheal lymph nodes. So that's what these 3 structures on the right and the 2 structures on the left that kind of look like kidney beans, those are going to be, again, these paratracheal lymph nodes. And so if those are enlarged, sometimes you can actually see them on imaging, and we'll see an example of that a little bit later. So the next important level is the aortic arch level, which is at the level, the vertebral level T4. And so in this case now, you can see this large arching structure right here, which is clearly the arch of the aorta. And so at this point, you can also see the superior vena cava. So at this point, of course, the right and left brachiocephalic veins have anastomose to form the SVC. And then, although you don't see it well in this image, you should be able to see the azygous vein cutting across and dumping into the superior vena cava as well. So back here, you can see the azygous or azygous vein, but again, usually about approximately this level, sometimes a little bit lower, it just depends on the individual, but approximately this level, T4, T5, is where you'll see the azygous vein dumping into the SVC. And once again, you can appreciate the trachea right here, the esophagus back here, and then you can make out a few lymph nodes, again, paratracheal lymph nodes at this location as well. Now at the next level, we have at the T5 vertebral level, this is the aortopulmonary window, or the AP window level. And so at this level, you can appreciate both the ascending and descending aorta. So here's the ascending aorta, here's the descending aorta. Notice again, the descending aorta is going to be located on just to the left side of the vertebral bodies as it descends through the thorax into the abdomen. The superior vena cava has not changed its position, so again, it's still located on the right side of the superior mediastinum here. And then the left pulmonary artery is something that usually you can appreciate, although you don't see it well in this image, but again, it'd be kind of right in this region right here. So again, we'll see that a little bit later on, but again, it would be located, again, where you'd expect to see that AP window where that left pulmonary artery is going to be coming off. So again, this image just doesn't show that very well, but in any event, this is the AP window level. And so this level is also an important landmark for enlarged lymph nodes. So you can see, again, in here where there's a number of lymph nodes, and so if those are enlarged, it tends to be very obvious, and many times it'll actually affect the appearance of the AP window, which again, we'll look at that a little bit later. And you can also here appreciate some of the pulmonary vessels coming off the hilum of the lungs. So now in this image, this is a diagrammatic view of what we were just talking about. So you can see the superior vena cava like we talked about, and the ascending and descending aorta. These lymph nodes right here are the subaortic lymph nodes, so they're sitting just underneath the arch of the aorta. You can still see the paratracheal lymph nodes right around the trachea. Here's the esophagus, and then this back here represents the thoracic duct, which you don't see very well in the image. Really, you can't make it out in the image that we just saw a moment ago, but over here you should be able to still see the azygous vein or azygous vein as it's ascending. So they left that out of this diagram. So with lymph nodes, something to understand with CT scans is, and to a lesser extent on MRI, you'll see what's called the hilum fat sign. And so this occurs due to the fact that the hilum, if you look over here on the right-hand side, this is a histologic view of a lymph node. You'll notice that in the hilum, you have this fatty infiltrate that is normal and is normally located within a lymph node. And so obviously that's not going to look quite as dense as the rest of the lymph node. And so again, you can see here, this is a really good example where it gives it sort of this kidney bean type appearance as a result of that. You can also see a little bit of that over here, and then even here where it kind of looks like a donut type appearance, as outlined by that image right there. So again, keep in mind that that's a typical appearance for a lymph node when you're looking in the thorax, and so that can be a really good way to differentiate whether you're looking at a blood vessel versus a lymph node. The next level is the main pulmonary artery level, which is located at the T5 vertebral level. And in this image, some of the key, or at this level, some of the key structures that you want to make out include the main pulmonary artery or the pulmonic trunk. So you can see that located right here, right before it branches into the right and left pulmonary arteries. So again, hence the name main pulmonary artery level, is because it's where you can see the pulmonic trunk branching or bifurcating into its right and left pulmonary branches. The bronchus the trachea should have bifurcated by this point as well into the right and left main stem bronchi. So you can see here's the left main bronchus and the right main bronchus right there. The left pulmonary artery, you'll want to note, is just slightly higher than the right. So again, you can see more of the left pulmonary artery here versus the right. And we'll look at on complete anatomy here in a moment why that is. Kind of convince yourself that is indeed the case. And then we see, once again, the ascending and descending aorta very clearly. And then here's the azygous vein or azygous vein located right there as it's ascending towards the superior vena cava. So if we go over to complete anatomy here for just a moment, again, I'm just going to rotate this around so you can appreciate this a little bit better. But I mentioned a moment ago that you have the right pulmonary artery is slightly higher than the left. And so I think the left is slightly higher than the right pulmonary artery. So here you can see the right ventricle, which, remember, that's the majority of the right or the anterior surface of the heart based on its orientation anatomically. And so we can see the pulmonic trunk or the main pulmonary artery, and then here's the left pulmonary artery and the right pulmonary artery as it's coursing underneath or inferior to the arch of the aorta up here. Just a couple other notes to make real quick, since we talked about the 5 vessel level. So here you can see the right brachiocephalic vein, the left brachiocephalic vein. So again, that diagonal course of it is what gives that more of an oblique or kind of a elongated appearance at the 5 vessel level. Here's the innominate artery of the brachiocephalic trunk. And then we have the left common carotid and the left subclavian artery, which, remember, the left subclavian is going to be larger than the left common carotid. And so if we get some of the aorta out of our way here just for a moment so we can see it a little bit better, here I think again you can sort of note the height, so to speak, of the left pulmonary artery compared to the right. So you can see how the left is clearly slightly higher than what the right is. And so again, that's why you're going to see at the level that we were just talking about, where at the main pulmonary artery level, you're going to see more of the left pulmonary artery than the right. So keep that in mind when you're viewing this level of the thorax. And again, here's the diagrammatic view. So we mentioned the ascending and descending aorta, the superior vena cava, you can see right here, the main pulmonary artery, that's then again branching into the right and the left pulmonary arteries, which again in this image they excluded you can see just a small part of the left pulmonary artery. It's going to look a little bit different than what it did in the previous image, but it gives you the basic sense of what you'd be looking at. And then you can see once again some of these lymph nodes that we had talked about previously, and then once again you can also see the the bronchi over here and over here, as well as this right here. These are all representing bronchi. So we're past the main stem bronchi, now they're branching into additional branches. And so then you can still see the esophagus coursing just anterior to the location of the vertebral bodies. And then thoracic duct, again, you're not going to appreciate that very well, but you should still be able to see the azygous vein or azygous vein as it's ascending. So we have the high cardiac level. So this is going to be located at T8. And the main structures that you can appreciate at this point include the left atrium. So you don't see that particularly well, you do see that right here. So this is the left atrium on this view. Here's the right atrium, and then kind of sandwiched between those, you have right here the aortic root. So this is usually right about the sinus of Valsalva, as it's called. So that's right about the level of the aortic valve. And then you can see the right ventricle anteriorly, and then you don't really make out the left ventricle very well, but you'd start seeing it kind of over here in this region right here. So again, you can see left atrium, right ventricle, and then again, left ventricle would be showing up here shortly, ascending aorta or the aortic root. And then back here we can see the descending aorta next to the azygous vein. And again, this is the T8 vertebral level. And then over here you can actually make out some of the bronchi that are, again, segmental bronchi as they're going into the various bronchopulmonary segments of the lungs. Now at the low cardiac level, so this is going to be towards the base of the heart at T9 vertebral level. So some of the structures that we can appreciate here include the right atrium. Again, this is going to be the right atrium right here. And then the right ventricle, which you can see right here. And then this is the interventricular septum right there if you look closely. And then all of this over here represents the left ventricle. And then, again, I already mentioned the interventricular septum. And then you can also make out through here, this thin structure right there. That's the pericardium. So you can see a little bit of pericardial fluid in here as well. So the normal pericardium is only about 2 millimeters thick, so it doesn't look very, very notable on CT. But again, you will, of course, with pathology, notice a dramatic enlargement of the pericardium. Again, you can see over here on the left, you can make out part of the pericardium there as well. And then you can see a pleural effusion located down here. So now at the T9, T10 level, this is usually where you start seeing the dome of the diaphragm. So you can see on the right side, remember the right diaphragm, as we talked about in the previous video, is higher than the left. And so we're starting to see the dome of the diaphragm. You can also see the IVC, the inferior vena cava, located right here. So remember, that's going to be located at the T8 level, the opening in the diaphragm. So this is above the caval opening. And then we're looking at approximately the level of the esophageal hiatus. So here's the esophagus right here. And then remember, the aortic hiatus for the descending aorta is going to be located at the T12 vertebral level. And so this is the same or similar diagram to what we just looked at. So where you can see the right atrium, right ventricle, left ventricle, coronary sinus, which I didn't point out over here, but you can start seeing that cutting across. Actually, let's see. Here in this image, you can see the coronary sinus coming across right here. So that's what this is showing you, the coronary sinus as it's dumping into the right atrium. Once again, you have some additional lymph nodes that you can appreciate at this point, esophagus, descending aorta. Again, thoracic duct you won't see very well, but in some cases you'll be able to start seeing the liver at this point as well. So again, this is still probably the dome of the diaphragm, but in some other images you'll see where we start getting into the actual liver parenchyma at that point.